Well, good morning, good afternoon, good evening, where you are, wherever you happen to be. My name is Brad Bollinger. I'm the publisher of the North Bay Business Journal. And thank you for being here for the second installment of our 21st annual healthcare conference. We have assembled here this morning 6 of the leading medical professionals and executives in our region to tell us what they see on the ground right now at this very extraordinary time that we're in. So we're very lucky to have them with us. And we're here today, can offer this free to our attendees because of our incredible sponsors and supporters here this morning, our co-host Western Health Advantage, our underwriter, Sutter Health, our major sponsors, Marin General Hospital, the Meritage Medical Network, Providence St. Joseph Health, and our corporate sponsor, Aurora Behavioral Health, Northern California Behavioral Health System, and a special thanks here this morning to the Sonoma County Medical Association. So we decided to move to this virtual platform with our events. This is, I think, our 16th virtual event, because we wanted to continue to fulfill our mission to bring people together and to get good information out there, and how there couldn't be anything more important than getting good information right now in this pandemic. So to introduce our 6 presenters here this morning, I want to please welcome Karim Arif, who is the Chief Medical Officer for Western Health Advantage. Thank you very much for being here with us this morning.
Hi, Brad. Good morning, folks, and good morning, audience. It's a pleasure to introduce this really expert and august panel of folks. I'm looking forward really to listening to the conversation. I'll go in no particular order, and let me get some folks introduced to you. So first to join us is Dr. Michael Schulman, who is the physician-in-chief at Kaiser Permanente Santa Rosa Medical Center. He holds many other hats as well, I'm sure, and as you folks get into the conversation, you'll hear more about that. We're also joined by Dr. David Klein, who is the CEO at Marin Health. Tyler Hedden, who is the CEO at St. Joseph Health, Sonoma County. We also are joined by Susan Rose. Thank you, Susan, CEO at Northern California Behavioral Health System. Then we're also joined by Tarek Salaway, who is the Senior Vice President and Area Manager at Kaiser Permanente Marin-Sonoma area. And finally, Dr. William Carroll. Thank you, Dr. Carroll, for joining us literally last minute. It's so appreciated. Chief Medical Executive at Sutter Santa Rosa Regional Hospital. Thank you, Brad.
Thank you. Thank you, Dr. Arif. Thank you so much for doing that. And again, thank you to all of you for saying yes when we reached out to you to be here this morning. So the way it's going to go for our audience, we have assembled some questions in advance with relatively short answers. And we're going to go around. By the way, I should mention Dr. Carroll, Dan Peterson, the CEO of Sutter Health, was called away to a meeting, and Dr. Carroll agreed to come in to be with us here this morning. But before we start into the actual questions, I want to go around and each of you just introduce yourself a little bit, tell us a little bit about yourself and your organization. And let's start with you, Tyler, if you would, please.
Yeah, sure. Tyler Hedden. I'm Chief Executive for St. Joseph Health, Sonoma County. I've been the Chief Executive for close to 2 years now, and have been at St. Joe's for 4 years, coming up on 4 years. As you know, St. Joseph Health has been in this community for a very long time. Santa Rosa Memorial Hospital has been here for over 70 years now. It's a level 2 trauma center, sees about 2,600 trauma activations every single year. We have a busy emergency department that sees over 40,000 patients every single year. And we are a STEMI receiving center as well, and see quite a few of those every single year, around 300. So really in support of our community's time critical diagnosis needs here at Santa Rosa. And then also at Petaluma Valley Hospital, where we operate a medical surgical hospital and emergency department there, and overall really covering the needs of Sonoma County from the North County to the South County. So,
thank you. Thank you, Tyler. Dr. Carroll, would you go next, please?
Yes, thank you, Brad. My name is Bill Carroll. I'm an internal medicine physician and internist. I'm the chief medical executive at Sutter Santa Rosa. I've been in this position for about 9 years. I have been in the community for 26 years. So Sutter Santa Rosa Regional Hospital is part of a integrated healthcare delivery system. We are in the Sutter Health Network. Sutter Santa Rosa, this particular facility was built, is now 6 years old. We're an 84-bed hospital. So sort of on the smaller to medium size, but the types of services that we provide here really are more comprehensive than hospitals typically of this size. So we have a comprehensive cardiovascular program, including open heart surgery. We're a STEMI receiving center. We do TAVRs and have a very comprehensive electrophysiology program. We're a joint replacement surgical center. We're the 6th leading facility in the Sutter Health Network. We also have a family medicine residency, which is affiliated with UC San Francisco. That program has been in the community since the 1930s. We're very proud of the residents that are turned out every year. There are 12 graduates, and many of the family medicine physicians that are practicing in Sonoma County are graduates of the program. So we also have a very busy emergency department. We see about 36,000 patients annually. Unfortunately, our capacity emergency department was built for about 25,000 visits. So expanding our emergency department is part of our expansion project. So I'll leave it at that, but we're excited. Before I sign off, I just want to say that Dan Peterson, our CEO, was very disappointed that he couldn't participate. He, of course, had planned on being a part of this panel, and in the last 2 days, an urgent matter came up, and he had to address that at the same time. So he sends his regrets, and I'll do my best to pinch hit for him. Thanks.
Thank you, Dr. Carroll. How about next to you, Susan?
Hi, I'm Susan Rose. I'm the CEO for Northern California Behavioral Health, which includes both the hospital in Santa Rosa, Aurora Santa Rosa Hospital, and our brand new facility, Sacramento Behavioral Health Care Hospital in Sacramento. Currently, there's 95 beds at Aurora Santa Rosa Hospital, but we're expanding 49 beds, which should be complete any day now. And then again, the brand new facility in Sacramento, which is 117 beds. And the timing of both the expansion and the brand new facility couldn't come at a better time. And I'm thrilled to be serving our community.
Thank you. Thank you, Susan. Next to Tarek.
Hey, good morning, everybody. Good North Bay Business Journal colleagues and my colleagues here from the healthcare sector. My name is Tarek. I'm your Senior Vice President, Area Manager for Kaiser Permanente in both Marin and Sonoma counties. Kaiser, as founded in the Bay Area in the 1940s in Oakland with the thought that if we could strive to keep people healthy and ensure their health and well-being, that will mean success for our community. And so that mission has really driven Kaiser to grow significantly and successfully to now a company with over just about 13 million members, heavily in California, Northern and Southern California. I've been part of the Kaiser family for just under 2 years, coming most recently from Southern California. And Kaiser is very much a major partner in this community in both Marin and Sonoma counties on that mission to health and wellness. We're known for our quality. We're known for being distinctly well integrated between our physicians, our health plan, and of course, our hospitals and clinics. And that has really helped us achieve what I consider our brand distinguishing factors around quality, our ratings from the NCQA and all our preventive actions. I'm pleased to work with a wonderful partner Dr. Michael Schulman, who's joined us today. I also work with his colleague, Dr. Naveen Kumar, in our San Rafael Medical Center. He could not join us because we were actively in our Joint Commission stroke certification survey, so he's covering for both of us. It's a pleasure to be here.
Thank you, Tarek. Dr. Schulman?
Yes, thank you for inviting me to join the distinguished panel. It's a privilege to be here. My name is Michael Schulman. I'm the physician-in-chief of the Permanente Medical Group in Santa Rosa. And as Tarek mentioned, we are a highly integrated collaborative organization between health plan, hospital, and the medical group. And I'm also a practicing urologist here. I joined Kaiser Permanente in 2006. I moved here from the Midwest and after medical school and training, and became physician-in-chief 3 years ago, October 1st. I joined the group primarily because it's a mission-driven, physician-led group with a strong focus on exceptional quality and care experience for our members. And I don't have much more to add other than what Tarek said. It's a pleasure being here, and so I look forward to the panel discussion.
Thank you. And then finally, last but not least, David.
Hi, good morning. I'm Dr. David Klein. I'm the CEO at Marin Health Medical Center and also for the Marin Healthcare District. And I think I'm the new kid on the block, and it's a pleasure and an honor to be here. I'm meeting some of my colleagues. I've been here all of 2 months, actually 2 months and 2 weeks, 3 days and 4 hours. And it's been a great experience. I came most recently from the city of San Francisco, where I work for Dignity Health. I was the president and CEO of St. Francis Memorial Hospital in St. Mary's Medical Center, and then spent the bulk of my career in Texas, where I started as a general surgeon before moving into full-time hospital administration, but very, very happy to be here. Marin Health and Marin General Hospital has been part of this community and the Marin community and North Bay since 1952, and is providing exemplary, high-quality, safe, efficient patient-centered care since that time. We're particularly excited in the last 2 months, and I know we'll have an opportunity to introduce our new facility, our new Oak Pavilion, which really exemplifies the care that we've been able to provide. It's a very patient-centered healing environment, and hope to have the opportunity to share some of those features with the audience today. We continue to serve very advanced medical care, state-of-the-art technology. We're a full-service acute care not-for-profit district hospital. We provide all services, including trauma center, like some of the other hospitals. We have behavioral health, labor and delivery, and a number of other high-quality service lines. So it's really great to be a part of this program, and I'm a Marin resident, so extra happy to be here. Thank you.
Thank you, David, for being with us so early in your tenure, which we all hope will be very long and fruitful. So thank you.
Thanks, Brad. Thank you.
So let's get into the topic at hand, which is there's really only one, right? And that is, I've asked each of the panelists here to tell us what they're seeing on the ground from their particular viewpoint. And we're going to start with Dr. Carroll.
Thank you, Brad. Well, we are seeing an increase in the number of positive COVID cases. You read about it every day in the news throughout the country. The rates of positivity are going up, and in some places, particularly the upper Midwest, dramatically. They're definitely rising in California, though not nearly as dramatically as they are elsewhere. We are very prepared for any surge which may come to Sonoma County. As all of the affiliates and throughout Sutter Health and all the local hospitals have been working since really the end of February or even before that, preparing for this pandemic. Especially in April and May, we developed a very comprehensive surge plan, which fortunately at that time we never had to activate, but it's still in place, and we're continuing to refine it and review it in case we need to bring it back. So at this time, over the last 7, 8, 9 months, we've become very confident with our ability to manage COVID patients. Our team is really impresses me every day, really. It's inspiring, the courage and grace and confidence with which they approach these patients. And what we've learned is for for the near future, COVID is going to be part of our everyday operation. So though we shut down for more elective procedures in the spring, we're now realizing we're going to be managing both COVID and non-COVID patients indefinitely, and we're doing that in a really, really safe way. Really, there's never been a time in our approach to COVID where we haven't had adequate PPE. And again, being a part of an integrated healthcare system like Sutter Health has enabled us to be very confident in terms of our supply chain, and that continues to be the case now. Thanksgiving is next week, and really an important holiday in this country, and one of my favorites. It's really a great time to be thankful for all that we have. But this year is clearly not the year that we want to gather in the ways that we typically do. So we are really trying to message that. So in terms of safety, in terms of our staff and our patients, we're very confident that we're delivering safe, reliable, excellent care. Again, adequate, ample PPE supplies. We're really emphasizing to our patients and our staff and our colleagues that it's essential, just the three basic things, and that's wearing a mask and hand washing and social distancing. So those are critical. Everybody's read over the last 7 or 8 days about the exciting news for a potential of really 2 new vaccines coming out. And so it looks like probably by next month, we're going to have, looks like about 20 million doses. So Sutter Health is really preparing for what our role would be in terms of a distribution of vaccines. So that's one thing that we're very excited about, obviously, but we are absolutely prepared and ready if a larger surge comes. We hope that it won't happen, and we don't expect anything like what happened in New York and the East Coast earlier in the year, but we are prepared regardless of what happens.
It's good to hear. Thank you, Dr. Carroll. Susan, how about you? What are you seeing on the ground?
So similar to what Dr. Carroll just described, I think it's a little bit different for a freestanding psychiatric hospital compared to a med-surg facility. In the beginning of the pandemic, we were able to maintain the number of patients that we were serving in our community. However, as we also see positive COVID patients within our facility, it ends up limiting our ability to continue to service additional patients on those units. So we're working closely with CDPH and Sonoma County Public Health. We have increased testing of both of our patients and our staff, 100% testing. We have added N95 fit testing and masks for all of our staff. And about, 3 weeks ago, I was able to get a large quantity of face shields. So in addition to our staff, 100% of our staff wearing the N95 masks, we're also adding on face shields. And I think we've talked in other meetings before about the questionnaire and temperature taking that we're all doing prior to employees entering or anyone entering our building, whether it's the patient, staff member, they're filling out the questionnaires and then also doing the temperature checks, and then extensive cleaning throughout the facility so that we can go back to servicing more patients.
Great. Thank you. Thank you, Susan. Your audio was a little off there, but nothing fatal, just a little bit off. So I'm going to turn now to Tarek and Dr. Shulman. The same question. What are you seeing on the ground at Kaiser?
So I'm very pleased to share that there's been a great deal of contingency planning as we face various waves of this pandemic. And so now we're going into the third wave in our country and how it's impacting the Bay Area and specifically our Marin and Sonoma County communities. So we are well prepared with our contingency plans for any surge. And as Kaiser's commitment to ongoing safety and excellence, we continue to learn and get better and better along the way. And I want to applaud my physician partners like Dr. Schulman for what we've done in the way of prevention, what we've done in the way of early detection, what we've done in the way with our entire flu vaccination program as another model of that. And so we remain prepared for any surge should they need to hit our hospitals. We're also importantly proactively managing patients before they even get to a hospital, and being part of the integrated delivery system enables us to do that. We've also made special attention to the most vulnerable, particularly the elderly who live in congregate facilities, who live in board-in cares or assisted living facilities. And so we really started that work in Marin County. We started that work with county partners, with healthcare partners, where we have screened patients, whether they're Kaiser members or not, in a team fashion across multiple assisted living facilities to be able to ensure they are safe, there's proper PPE. We work with those local facilities to bring the infection prevention knowledge and know-abouts to them so that they can practice safely in their congregate living environments as an example of that. So that's enabled us to keep a step ahead in this journey as we face the multiple challenges facing our community. And I'll turn over to Dr. Schulman.
Thank you, Tarek. I just want to reiterate that, as prior panelists said, the country's entering the third main surge for COVID, and we are prepared. We've had 8 months now to really put the infrastructure and right people in place. And I agree with Tarek. We are prepared for the possibility of another surge. I can speak specifically to what we're doing on the outpatient side. That's been unique for us. We've set up early on a dedicated COVID clinic for any patients who have had symptoms for the protection of the patients. Of course, our first priority is always safety, so that really underpins our strategy. We've opened up screening and testing for a wide variety of patients, from symptomatic and non-symptomatic patients, and we can currently test about 600 patients a day for COVID, and our patients are booking electronically now through electronic visits. As Tarek said, we invested early on in looking at how we can support our most vulnerable population, especially in the residential care facility for the elderly. We've provided significant support there. And of course, an ongoing concern in the pandemic is the delay in treatment for other conditions. Other conditions don't go on hold during the pandemic, and so we've made a real effort to stay open, and we are open for care. We've pivoted sharply towards telehealth and video visits, and we're currently providing over 1,000 video visits per day in our medical center. And Kaiser Permanente as an organization has also been on the forefront of research. We are enrolling patients in many COVID-related studies, especially the Pfizer vaccine study, which was recently published. And of course, the flu season is approaching, and so we've taken a very aggressive approach to flu vaccinations. We have a flu vaccine drive-through currently seeing anywhere from 500 to 1,000 patients per day. Our goal is to vaccinate as many of our patients and employees as possible. And so we take the threat of a twindemic, flu and COVID, seriously. And we continue to focus on safety for our patients and our people.
It's the first time I've heard that phrase, twindemic. It's frightening, but it's so appropriate. So we don't want that for sure. So thank you, Michael. David, how about you? What are you seeing on the ground?
Well, I think like my other colleagues, we're really not seeing the volumes in our hospital that they're seeing across the country, which I think is a good thing. I think it's a testament to the great focus that people in the Bay Area have have paid to this pandemic. In fact, today we only have a single patient in the hospital that's COVID positive, and they're not very sick. And I would say we've been in single digits over the last 2 to 3 weeks, which is really a good thing. That's different than what we're seeing in our clinics and in our nursing homes. We're seeing a increasing prevalence in those areas, and so we really want to focus on our community and the vulnerable populations. And through grants from the healthcare district and working in partnership with many of the folks that are on the call here, we've been able to do outreach into some of these areas where may have healthcare disparities and inequities, so that we can focus on those most vulnerable populations. I think that's made a big difference. We too are prepared for whatever the future is going to bring. We have adequate PPE supply, more than adequate. Like others, we've stockpiled and we're ready. Although I don't anticipate a complete shutdown, we're prepared for whatever we may need in that regard. We just got a new testing instrument, which expands our internal testing capabilities. We've been testing through internal resources and using county resources and UCSF, and kind of begged, borrowed, and stealed wherever we could get a test done in an appropriate manner. But now I think that we have adequate testing where we can not only test our staff and employees and patients, but we may even be able to provide expanded testing to our community, which we do in our clinics. And then I think lastly, like others, I just want to take a second to thank our frontline healthcare workers and applaud their heroism and their resiliency. And these are folks that put themselves in harm's way, at risks and at their own peril and jeopardy, not only from the beginning of the crisis, but currently. And I don't think enough is said about the great work that our teams do at our hospitals in caring for our communities and keeping all of us safe, quite frankly.
Here. Thank you for that. So Tyler, to you finally, what are you seeing on the ground from Providence?
Yeah, sure. I wanted to piggyback off of David's comments regarding our caregivers and just how heroic they are day after day, coming and caring for our community. It really inspires me when I go out on the units and go to the COVID units and ask how things are going, if they need anything, and it's just overwhelming to see how much care that they are providing, and compassion to our patients and our families, and knowing that communication is a big issue right now between patients and families because of the isolation, but knowing that they're taking care to do that as much as possible. So that's what I would say. And again, like David mentioned, numbers here are in the single digits, and just want to really thank the community for making that happen. That doesn't happen without people properly socially distancing, masking, and doing the things that we need to do to take care of each other. I think it's here at St. Joseph Health, we are prepared for a surge and really have the benefit of being with a larger integrated healthcare delivery system that is seeing spikes across our system in Texas and in Southern California, and fortunately we haven't seen those spikes. But it's one of the things that is really paramount is ensuring that we have enough staff if there is spikes. And so that is something that our system, I think, is uniquely developing and able to address, is being able to kind of have that pool of talent really across the Western United States to really be able to help out if there is a surge. I think the other thing that I would say too is, PPE or testing supplies, again, is something that we've been able to do very well at. And we have multiple platforms here in Santa Rosa, and then also one at Petaluma that allows us to ensure that that our caregivers can be tested, and that our patients are tested before procedures, and in being admitted to the hospital and coming to the emergency department. So things are safe here. People are getting screened before you come into the doors, and we want to make sure that everybody knows that this is a safe place to come and get care, just as all the providers here have talked about. And very excited about the planning for the vaccine as well. We do know that this vaccine has to be stored at low temperatures, and we have a freezer that can help us store it at those low temperatures and really help to be a distribution center and really help aid in the deployment of this vaccine to our community.
Great. Well, thank you. Let me see if I can summarize, so in case somebody just joined us, that we're prepared for a surge, but there is no surge at this point, thank goodness. And we want people to come and access their regular healthcare. It's a safe environment to do so, because we don't want to replace one pandemic with another one of some kind, some chronic condition or something. So, well, thank you for everyone for your work. And by the way, I know this, but maybe not everyone does. All these people work together, even though they're different organizations. They all work together to benefit all of us. So let's maybe go on to the next question. I think I heard from all of you in the preparation for this meeting here today that everyone's seeing a disturbing rise in mental health issues in the cases that you're seeing. So I'm going to ask you to each just elaborate on that a little bit, and I'm going to start with Susan.
So for our hospital, it's not the number of cases that we're seeing in our facility, it's the type of patient that we're seeing. So they're far more acute than our patients have been in the past. We talked about this in the preparation meeting and also in a meeting for the Hospital Council of Northern California. I think Tyler said that his ER mental health visits were up by a large percentage in August, but it was also attributed to a time when we had fires in our community. And during that time, our facility started to condense the number of patients that we had in preparation for an emergency evacuation. So at some point during 6 days in August, our facility was unable to accept any patients in our community. I do believe that there will be a huge mental health surge in patients and that we haven't seen that yet. I think people are in their homes suffering. And I think the best thing and the most important thing our company can do for our community is what we're doing, which is preparing for that surge, expanding our outpatient services, expanding the inpatient services by 49 beds, which would make us a 144 bed hospital. But as mentioned before, I also think by Tyler, we need to really look at our staffing and how we're going to be prepared with our staff in order to take care of the patients that are coming.
Right. Thank you. Well, thank you for your work. And thank you, Susan. So next to you, Tarek and Michael, what are you seeing? Is it similar to what Susan described? What are you seeing at Kaiser?
Sure, I can start, and what I'll say is I absolutely want to underscore what Susan is saying. We're seeing the impact of cumulative crises, particularly in Sonoma County. Couple fires, floods, pandemic, economic constraints across the board. And that is absolutely presenting itself in the doors of our hospital and our emergency department, which represents what's happening in our community. The additional piece here that's a little more deeply concerning is the incidence and rise among pediatric psychiatric cases that we're seeing that are, as Susan said, very acute. And these are our most vulnerable pediatric patients, and even more so when there's a psychiatric diagnosis. There are very few resources across the state and across the country for these patients. And it takes an enormous amount of effort to try to find resources and care providers for the pediatric patient population. So I would say, yes, the incidence is up. Substance abuse impact, we're seeing it even in our medical population that's admitted with cardiac sequelae, pulmonary sequelae, et cetera. So we remain very, very focused on this as a major priority for our community. And I'll hand it over to Dr. Schulman.
Yeah, thank you, Tarek. Yes, we have seen an increase in not only the numbers, but the acuity of mental health cases, both inpatient and outpatient. We are looking at everything we can do to provide the right number of providers to take care of this growing demand. Our therapists and psychiatrists have moved to a very strong telehealth video visit platform to provide care for patients who don't want to leave their homes. Of course, we are open for those who do need face-to-face visits. So we're looking at continuing to expand our outpatient services to meet the growing demand.
Great, thank you for that. So next to you, David, what are you seeing? And Marin, I might ask the rest of the presenters, what would you suggest, people do so that this doesn't end up being an emergency room situation?
Yeah, I think that's a great point. And based on what we're seeing in our emergency department, people that are presenting with mental health issues, psychosocial problems, substance use problems is up 40% of what it was pre-pandemic. Now, not all these people are being admitted. In fact, most of them aren't, and ironically, not many of them actually have COVID. But I think, as others have said, it's sort of the sequelae of what's going on, the social distancing, the lack of appropriate social cues, et cetera. And the way to fix that is a real dilemma, because it doesn't seem that we're going to be out of this pandemic situation for a while. But I just think that paying attention to all aspects of our folks in our communities, making sure that they're getting prompt and appropriate care when they need, making sure people are being checked on regularly, especially those that don't have a infrastructure that can support them, and making sure that publicly they know that care is available for any of their needs, and to call early rather than late. And so I think just provision of services is what's going to make a difference until we get out of this crisis.
Great. Tyler, how about you?
Yeah, so like everybody's talking about, the volumes are staggering as compared to last year at the same time. Our emergency departments, up anywhere from 17 to 24%, and mental health as a primary or secondary diagnosis, and in sheer numbers, 60 to 70 more in August than we saw the prior August. So that does add a weight to our healthcare system. I think one of the things that is critical, though, is some of the work that we're doing in our community health investment department. We've had a group of caregivers get together and put together a seminar on suicide prevention, albeit Zoom, and really making sure everybody is understanding and recognizing the symptoms, the signs to that you have somebody that's not in a good state. Also, just really trying to be a glue, and in partnership with pretty much everybody here that's on this call in terms of access to mental health resources. We know that it can be a challenge, and it's really important to us, and it's one of our major focuses. And as we know, there's also a lot of stress related to kids doing work at home and Zoom learning. And so we do have an SOS program. It's called Support Our Students, that we've worked with Sonoma State and work with bilingual students to help our Latinx population really be able to really take advantage of online learning. We know that that's one of the major issues that have come up, is the concern about their children being able to learn as effectively as they used to in the in-person student setting. So.
Great, thank you, Tyler. Over to you, Dr. Carroll. What are you seeing at Sutter?
Our experience is very similar to what has been described already by each of the panelists. Our volume of mental health patients in the emergency department is up about 40 to 50% this year over the last 6 months compared to the same 6 months in 2019. So significant increase in volume. We don't have an inpatient psychiatric facility here in Santa Rosa, but throughout the Bay Area, our other Sutter health affiliates, many of them do. So we get a dashboard every morning looking at the number of beds that are available for acute inpatient mental health patients. we've seen, as a part of that, we look at how many patients in the Bay and the Sutter affiliates in emergency departments actually are waiting for an acute inpatient bed for mental health care. And it approaches 10% at times, which is really a staggering statistic to think about. We really appreciate the partnership with Aurora. We love to work with them. We also work obviously within the Sutter Health system to get our patients the care that they need, but it is absolutely a challenge. And we have had times where patients have had to spend an extended period of time in our emergency department. And we really want to get them the care that they need and get them to the right facility. So we work really, really hard at that. As others have said, substance abuse is an ongoing concern. Those patients frequently do end up in our inpatient facility, and it's really staggering the toll on the community related to this. I think many of us thought when this pandemic sort of unfolded earlier in the year that we'd be looking at a few months, and I think as people start to come to the realization that this is going to be going on indefinitely, obviously well into, if not through next year, and you add the shutdowns, you add the fires and the impact of that. I mean, it's just really, really taken a toll. So very similar to everybody else. Again, we do appreciate the partnership with Aurora and other hospitals in the county, and obviously with our affiliates throughout Sutter Health.
Brad, can I add a couple of things that I didn't say after listening to the panelists? I want you to know that our hospital listens to the communities, and we can tell what's happening based on the types of referrals that we're getting. So we know that treating pediatric patients, it's a huge concern for the community. And because of that, when we add on our 49-bed expansion, we're actually adding the license aged all the way down to 6. So that's completely different than what we're doing right now. We have the patients that we treat are 12 years and older, but because of the demand in the community, we're changing that licensing to 6 years old. And I think that's significant. The other thing is when we receive a large number of referrals, whether it's a large number of adult referrals or a large number of adolescent referrals, we can actually swing our units based on the needs of the community. So if we're seeing all of our packets are coming in their adolescents, then we move the adults over to 3 other units and we swing to 2 adolescent units. And that ebbs and flows with the season, not so much now during the pandemic, but certainly in years past during the summer, the kids would get better all summer long. And then right when school started, it would flow again. We're doing the exact same thing in our facility in Sacramento. And so I do want to send a message of hope that when patients emerge from their homes with mental health issues, that our company will be there to help service our patients and then the facilities in our community that we work with.
Thank you. Thank you for that, Susan. That kind of is a great segue into kind of a secondary question. The Sonoma County, this applies to Sonoma County, passed Measure O, which is I think a 1/4 cent sales tax for mental health services. So everybody here has a chance to impact public policy. So what impact do you think that's going to have potentially? And then maybe where should the money go? Does anyone want to take that on? Susan, you want to start?
I absolutely can start. So we also talked about this in our Hospital Council of Northern California meeting last Tuesday. We'll see what the impact of Measure O is once it's passed, and then the committees and meetings of how that money will be distributed ends up rolling out in the next year or so. For our facility, we can treat our patients, our inpatient acute patients, but if there isn't a place for them to go once they're no longer acute, then it impacts the entire community. So if the reduction in homelessness is what is focused on with Measure O. It would really help the rest of the community out, I believe. So the quicker we can get our patients out, the more we can end up servicing our emergency rooms.
So that they have a place to go. Tarek, or any thoughts?
So I think, yeah, Measure O is a very significant improvement for Sonoma County. And as a tax, it obligates the stewardship of public funding. So there's several areas of critical need. So Kaiser has committed $2 million in various programs and funding, and these highlight very much and reflect the vast array of community need that needs significant bolstering. Absolutely access to mental health counselors for various populations and services, including children, as I talked about earlier, and adolescents. Access for the undocumented population and the immigrant community, as well as several generations of Latinx community, both in Marin and Sonoma counties. So Measure O is for Sonoma County in particular. The economic impact to those communities is disproportionate in many ways, which then reflects the disproportionate healthcare impact for those communities. So those members of our community who are in crisis, who may not speak English, is a major focus of need. Housing for our community, substance abuse services for our community in particular. And I would say really community-based services such as crisis stabilization capacity is a huge need for all of us as healthcare providers. So crisis stabilization units are not necessarily acute psychiatric inpatient facilities. There are outpatient services where a person who's in mental health crisis can get proper treatment, can get proper placement. Many times that may be an outpatient program. These reflect some of the broad array of needs for us to really focus on, and really want to underscore those issues and substance abuse in particular, which is at a higher incidence rate per capita in Sonoma County than many others.
Well, thank you. Thank you. Tyler, how about you?
Yeah, I think we're all happy about the direction with Measure O, and are really pleased to partner with the county on how we can really utilize those dollars as effectively as possible. And as Tarek mentioned, the crisis stabilization unit, that impact right there for our emergency department is a very large one when you think about when we have a mental health patient in our emergency department for sometimes 24 to 48 hours. So we hope that the crisis stabilization unit and the PUF, the psychiatric health facility, will definitely help alleviate some of that strain on the system. And really, it's a great point that Susan made, is it doesn't do any good if they're hospitalized on the inpatient side and don't have anywhere to go on the outpatient side. And so that's something that St. Joseph Health Medical Group is really working on, is to get some embedded psychologists and providers in our family practice clinics for that. And also we have a partial hospitalization program and outpatient in our outpatient behavioral health center on College. And it's so important for those linkages to ensure that we really truly create a lasting road to recovery, but it's going to take all of us. And as we know, homelessness and access to behavioral health services are at the top of those lists, of that list.
Dr. Carroll, any thoughts?
I would just augment what everybody else has already said. We were thrilled to see the passage of Measure O. It provides desperately needed funds for mental health care in this county. And really the full gamut has been outlined, including, we're especially hoping that funding for CSU, the Crisis Stabilization Unit, will allow greater access for our patients. We're going to see any patient who comes into the emergency department, and we're going to do the absolute best that we can to provide the best care that we can. But we're not a psychiatric treatment expert care that they really deserve and need. Same with mental health, with substance abuse and the homeless problem. All of those are critical in terms of addressing the problem with mental health in this county. But we are really happy to see the passage and excited to see how this money is going to be utilized to provide care to our community.
I think it really reflects the generosity of our taxpayers to see that that's such a need. How about you, Dr. Schulman? Any thoughts on major?
No, I don't have anything more specific to add that hasn't already been well stated by the other panelists.
Great, thank you. David, anything you wanted to add to the mental health discussion?
No, I wish we had a Measure O. We don't in Marin County, and nothing that I'm aware of that's on the books for that. But I think that's where our dollars really need to be spent at this critical moment.
Well, maybe we can lead the way. So
yeah, sounds great.
So let's go to our next question, and this one I posed because a lot of our companies are extremely stressed in this situation that we're in. They've got to take concern for their employees and safety, and at the same time, if they're an essential service, delivering that service or food or whatever it might be, it's been companies have had to really work very hard on this this whole issue. So the question to all of you, and we're going to start with Tarek, is what would be your message to employers in this current phase of this pandemic, and how to continue to manage our way through it? Because it doesn't look like we're getting out of this anytime like next week or something. It's gonna be with us for a bit. So what would be your recommendation to how to manage through that?
First, I would communicate very clearly to our employers, including right now, what a critical role they play to our community and its vibrancy. And so as our community moves through this pandemic, the message of prevention and safety is paramount. We are committed as partners at Kaiser Permanente to help our employers function successfully with protocols, with safety practices. We have an entire playbook to help them move business forward in a way that is safe, in a way that helps our community receive services from them. Very importantly, with an array of tools, array of communication, and of course, how to use proper social distancing and or plexiglass where appropriate, that kind of thing, importance of staff wearing face shields where appropriate. There are definite ways that businesses can demonstrate and show and lead in the way. Many of them have already. We applaud them. The way that we go about moving through this pandemic is through safety until we can get everybody the vaccine and get a level of immunity for our community. And so businesses also play a role in ensuring all their staff get vaccinated for the flu right now, more than ever, which will help us all be safe as well. And there is accessible screening for COVID-19 for our business partners. That's very easy to use. As Dr. Schulman mentioned, we can do online scheduling for anybody. You don't need a doctor referral. It's simply a matter of what location's most convenient for you, et cetera. But really demonstrating the message of prevention and the practice of safety in the workplace, and as they encounter the public and customers, will help us continue to lead through this.
Thank you. Dr. Schulman, anything to add? I should have added when I asked that question is both how they're going to manage through the COVID pandemic, but then how the flu will possibly intersect with that, and what would be the recommendation of all of you to our employers?
Yeah, thank you. First, I want to acknowledge what an incredibly challenging time we're living through, and that is for employers and our employees, our families, ourselves. And I think as now we're in the 8th month of the pandemic, I don't want to minimize the risk of pandemic fatigue, which is impacting many of us and all of you in all likelihood. And so the message of safety first is really critical, that we are entering the flu season, and with the COVID pandemic entering another surge, I think it's really important to stress that the precautions around physical distancing, masking, and hand hygiene are more important than ever. I encourage all of their employers to encourage their employees to get the flu vaccinations. If people are not feeling well, please stay home. If remote or home work is possible, please, people should be working at home. Avoid congregate settings. I know holiday celebrations, Thanksgiving celebrations at work do occur, and COVID transmissions can occur at work when people let their guards down. In terms of where COVID intersects with flu, I think one encouraging point that I like to think about is to learn from what happened in the Southern Hemisphere. The Southern Hemisphere is exiting their winter and flu season. And what we're seeing in many countries in the Southern Hemisphere is a low acuity or less risk of the flu. Now, whether that's because the flu is less virulent this year, I don't know, or whether it's because of all of the mitigation strategies around COVID have also mitigated the risk of the flu. But I think that's critical. When we talk about mitigation strategies against COVID, they also apply to flu. So again, the physical distancing and hand hygiene in non-congregate settings is very important. So with that, I hope that I hope that's an optimistic lesson for us for our flu season. And regardless, we are prepared for what happens next.
Great, thank you. David, how about you? Again, your
Yeah,
message.
I really just want to echo what Dr. Shulman and Tarek had to say. And the first point is we're all in this together, and we're here to support our community and our business folks in any way we can, whether that's with helping them set up programs to protect their employees, or whether they need help with testing, any of those kinds of things. We're all businesses too. We're doing the same things. I think Dr. Shulman said it very well. We're not having any in-person meetings. All of our meetings are remote. We're sending people home that can work remotely, but we're also checking up on them to make sure that they're okay. The other side note is that as people go home to work, and especially the ones that have young children, they have to work from home. It can create, at least in the hospital industry, shortages of staffing that we may need as we go through the busy season. So I just think all the usual things that we're hearing with masking, the distancing, and working from home that everybody's talked about before will really make a difference. And then just from an economic standpoint, I think all of us have suffered profound economic concerns and issues. We're no different than the other businesses, and just sort of lock arms and know that we're going to get through this at some point, and we're going to come back resilient and strong is important. I agree with Dr. Shulman about the flu. All the predictions are that it won't be a bad flu season. For the reasons you said, mainly because the precautions that we're taking for COVID work for any virus. And so we're hopeful that it won't be a bad year, but we're here to support our communities in any way and fashion and form.
Never thought there would be a silver lining in the COVID.
Yeah, we've learned to do things a lot differently and sometimes better, for sure.
Tyler, how about you?
Yeah. Our workforce health team is out and about and really helping partner with local businesses to ensure that we're educated and they have the appropriate PPE to make sure that we're keeping everybody safe. I think a lot of great messages were already hit on, but in general, I think it's a good mantra is if you see something, say something, and that means that if you see somebody not appropriately using PPE, not social distancing, make sure that we speak up, because we're all leaders and we have to ensure that we stem the spread of this pandemic as much as possible. And likewise too, in the workplace, from a behavioral health standpoint too, if somebody is not kind of acting a little bit out of character, talk to them, take the time to not only just say, how's your day, but say, really, how are you doing? And taking some time, because I know that we've all felt that here. And, we're going through this kind of odd time where we're in a permanent crisis. And we've gone through the emergency phase of this. And now we're going through the the adjustment and improvising phase. And we've been through multiple of these. And so I think we just have to understand that that through those ups and downs, there's going to be fallout from just the sheer exhaustion and mental fatigue. And so, so knowing that that we need to keep a lookout for those things, and we are not immune to that as well.
Interesting. Maybe to paraphrase what you said, we're in kind of the fatigue stage, you know, where people, they haven't taken vacations, they haven't gone to the beach, they haven't, you know, done the normal things that bring them rest. So maybe that's what we all should be doing over these holidays. Just take a little time out, just relax a little bit. So Dr. Carroll, how about you?
I would say that our message is we want to support the employers in the work they're doing to help their employees, and encourage the employers to continue what they've done over the last 8 months, which is to really have those employees that can work at home do so, and those employees that are essential that need to be on site to make sure they're masking and distancing and washing hands and all the other things that we're really quite familiar with. But it really is essential, and especially in the context, as we've heard, you know, some pandemic fatigue, because that is absolutely real. But we need to maintain our vigilance. It's just critical, especially as we enter into the winter season. I would say the same thing about the flu shot, but regardless of the fact that it looks like it was relatively mild for whatever reason in the Southern Hemisphere, it's essential, it's critical that people get their flu shot. We just think that's really, really important, and so we're encouraging everybody to do that. The other message that I would have is it is absolutely safe to come and get the health care that you need. It's really, really important that you don't delay. It is perfectly safe. We are now 8 months into this pandemic, and we've learned so much. We continue to learn a lot, but we can deliver health care safely. And whether that's in the ambulatory environment, we are everybody is masked in the hospital or in the clinics. We temperature check everybody and do a symptom review before people come into our facility. Right. Obviously, within our hospital, visitation is limited as we try to mitigate the spread of COVID. But if we think that we may be facing somewhat of a surge over the next couple of months, and I think that's a very real possibility, this may be the time right now, you know, to come in and get the care that you need, because we've seen some unfortunate cases where people have delayed and the results have been catastrophic. So our message is the same, which is get a flu shot, make sure you're masking and social distancing, and don't delay. Get the care that you need, and it's safe to do so.
That's a great message. Thank you, Susan. Again,
so my message, I think, is a little bit different. I hope that all of the hospital partners we have are helping every, whether it's a business. My example I'm going to use are the nursing schools. So right now our hospital supports Marin, Mendocino, Santa Rosa Junior College, and Sonoma State. And what I heard directly from Santa Rosa Junior College is that up to 50 nurses did not graduate in the spring semester because they could not get the units that they needed in order to graduate their nurses. And so we really have to look long-term, higher level, and what commitment the hospitals need to make to these nursing programs to continue to graduate our nurses. We're already short-staffed with nurses in the community, and if we do not support our nursing programs, we're going to be in big trouble next year. So in order to do that, our facility purchased telehealth machines similar to what we have done with our psychiatrists, and we bring just the teachers from the different schools into our hospital, and they rotate the students around on a Zoom conference so that they're interacting and earning the credits that they need in order to graduate. So I hope that that's the contribution that our hospital is going to give back to our community, because I'm deeply concerned about the shortage in nurses.
Thank you for that. And that's an interesting impact I don't think anyone has even thought of yet. And that we're probably going to have more of these come our way as you know, we get back to quote unquote whatever normal is. So, well, thank you for that. So we have one more question to get to before we open it up to our audience, and that each of you on the conference here today has you've made an investment in our community in a facility, medical office building, new hospital, expanded beds, et cetera. I'd like to go around and have each of you just talk about that project just briefly. And I'm going to start with David. You've got a little project you just finished up.
What did we? Yeah, we're super excited to announce the opening of our new Oak Pavilion, which is a 250,000 square foot enhancement to our hospital. Adds over 115 beds. It's a state-of-the-art, patient-friendly healing environment that's highly technological and focused on patient safety and their comfort. We've moved our emergency room into that area, new operating rooms, new procedural rooms, new cath labs. We've got a brand new labor and delivery unit that's just spectacular, level 2 NICU, all the things that you would expect and that our community deserves in that area. But and it's also a LEED Silver designated, which is perfect for the area. But one of the things that's really interesting, and I know that we're running short on time, is that even though we had not heard of COVID when this hospital was designed, it's turned out to be the perfect COVID hospital. And by that, we have separate corridors for our staff and employees from where the patients and families are accessing. We have big wide hallways. All the services are highly developed for easy cleanability. Every room in the hospital can be converted to negative pressure. And then we have advanced video capabilities in all of our room, which in certain circumstances, when appropriate, our care providers don't have to necessarily enter the room if you have a patient that's under quarantine, although we do, of course, as part of patient care. And just as importantly, our patients can communicate with their families every day, all the time, directly through the video capability. So it's turned out to be a splendid facility. We've been in it a month and a half. The only complaints I'm hearing is it's a lot of steps. People are getting their exercise, but it is one of the most advanced, beautiful hospitals that I've had the pleasure and privilege to work at.
Great. Well, congratulations.
Yeah,
like
thank you.
Arrived just in time. So,
that was nice of them to build it for me.
Tyler, how about you?
Yes, we do have a new medical arts plaza just right across the street from Santa Rosa Memorial Hospital. Beautiful facility, 90,000 square feet, and many years in the making. And so really provides a great setting in which to provide healthcare. We know that healthcare is moving outside the four walls of the hospital, and this centerpiece really of our campus is really communicates that well, and is housing both family practice and our specialty services. And then on the first floor later this year, or in the next year, we're going to complete a radiology suite along with mammography. And so it's just going to be a great place for our women and children, and a great place to come on that first floor to get services. Also, wanted to just mention too, we had two huge ballot measures in northern and southern Sonoma County. And so we're making big investments into Sonoma County in both Healdsburg District Hospital and also Petaluma Valley Hospital. So Providence St. Joseph Health through NorCal Health Connect is making those investments and really ensuring that those communities keep the necessary care with emergency care and inpatient care at Petaluma and at Healdsburg, as well as OB at Petaluma, that they keep those vital services in their community. And so Providence St. Joseph Health and NorCal Health Connect is making a huge investment in healthcare for those communities.
Congratulations, and thank you for that. So Dr. Carroll, how about you at Sutter?
Well, I mentioned earlier that about 6 years ago, Sutter Health invested about $300 million to build this brand new facility, similar to what I think Dr. Klein said. You know, it's really every room is private. We have negative pressure rooms on every floor in the emergency department. So that has proved to be very, very helpful. But we were only in this hospital literally a year, and we realized we're going to need more capacity. So we are now in the middle of a 3-story expansion. The tower is going up. It's almost completely sealed in, so we'll be ready for the surgical beds, 2 operating rooms, 3 endoscopy suites. We're going to have 24 additional pre and post procedural beds for the operating room area. And then as a secondary expansion, which will happen after the tower opens, which is scheduled for April of 2022, so about a year and a half from now, then we'll do some internal modifications where we will be able to expand our emergency department. I mentioned earlier, we see about 36,000 patients a year. The ED was built for about 25,000 visits. So we're going to more than double the capacity that we have with an expanded emergency department. And that's really, really important. This whole, project is really important because, our goal, like everybody on this panel, is to serve the community. And we really feel like this will give us an even better chance to do the work, that we're committed to doing for the community, our patients, and their families.
Thank you. Thank you. Susan, how about you? You're working on some things as well?
We are. So I've mentioned a couple of them earlier in this conversation. We have a 49-bed expansion here in Santa Rosa, which will make Aurora Santa Rosa Hospital a 144-bed psychiatric facility. And then we've also doubled the size of our outpatient program. In Sacramento, we're building a brand new facility, 117-bed freestanding acute care psychiatric facility. In that hospital, we'll be creating a call center, which I think will help all of Northern California behavioral health, because we'll control where those patients go, whether they stay in Sacramento or they end up being transferred down to the facility in Santa Rosa. So currently about 40% of our patients come from Sacramento and beyond. That means that it's going to open up more bed space for our own patients here in our community. In the next 2 years, we'll be building a medical office building, moving our outpatient program out to the medical office building, which means we'll be adding ECT. Right now, if we have a patient that's severely depressed and needs ECT services, we have to bring them down to Marin in order to receive those services. So that'll be a big win for our community. Our corporation, there's 16 hospitals throughout the United States. They're adding 2 additional facilities in the state of California. And so I really do applaud them for building in California and working through OSHPD and licensing issues. So it's exciting times.
It is, and it wasn't too many years ago where we had 0 beds in our area. So
that's right.
Those investments. Thank you so much.
And it's been a wonderful partnership, just like you said, Dr. Carroll. When there's a difficult patient in the emergency room, people like Dan Peterson pick up the phone and give me a call to make sure that we're taking care of each and every one of those patients. So it's been a wonderful partnership.
Thank you so much. So Tarek and Dr. Shulman, any construction projects you have? I know you have one down in Marin County.
Yeah, sure. I'll start there. We're very excited about our Los Gamos Comprehensive Outpatient Center, about 150,000 square feet, that will be opening this summer. And that will house multiple clinical primary care, specialty care, outpatient procedure center. The facility will have lots of natural lighting. We're excited about that. But most importantly, it helps to expand access for our population really here in Marin County in a big and significant way. And in addition to that, as we move up north, we've got our clinics in Nevada, which provide excellent access. Petaluma has a major hub for our community as well, with 2 very large MOBs. So we'll continue to expand clinical services there. We've expanded a very nice expanded outpatient behavioral health program there, for example. But we're looking at expanding things like GI programs there as well. We're very proud of our Mercury Way facility in Santa Rosa. It actually is a model for all of us in KP. It really speaks to Kaiser's commitment to be 100% self-sustaining. So that building is 100% produces its own energy, and really a wonderful model of care. And it's an important part of our southeastern part of Santa Rosa that we serve there as well. And then I'll hand it over to Dr. Schulman. I know there's a lot we're doing digitally. That's important too.
Good, thank you.
Sure. The only thing I would add to what Tarek said about new facilities here in Santa Rosa, we do have the Mercury Way facility in Southwest Santa Rosa. And from a program level, Kaiser Permanente was recognized this year as the first carbon neutral healthcare delivery system in the United States. So we're very proud of that recognition, and it just acknowledges our commitment to be socially responsible in dealing with climate change. And of course, we're building a lot of infrastructure around the virtual world, but I think the question is really specifically around facilities. So,
okay.
Thank you.
Well, thank you, everyone. So we've got a little time for questions from the audience, and I've been sort of looking over a few that have come in, and one that I've found kind of interesting is the virus, the COVID virus has mutated several times. I'm not an expert. I don't know if that's actually the case, but will the vaccines be effective against these mutations, if that's even possible to answer at this point? So who wants to take that on? Maybe one of our physicians here will want to try that one.
I'll take a stab at that one. I'm not an immunologist or an infectious disease specialist, but I will say the answer, I think, is we don't really know for sure. We're still very early in the vaccine development phase. These two new vaccines, the Pfizer and the Moderna, are really, their preliminary data are really, exciting. Both of them use a newer technology that's called mRNA, in which a fragment of basically the RNA of the virus is used as the vaccine that's incorporated into immune cells in the human body, and enables the immune system to be exposed to just a fragment. And both mRNA vaccines are coding for part of that glycoprotein spike. Everybody sees the schematics of the coronavirus where it's the ball with the little spikes. So there's a portion of that is this RNA vaccine will induce an immunologic reaction to the spike protein. And so the results preliminary for both vaccines are really, exciting. There was both of them showed a high degree of protection, not quite 100%, but approaching mid-90s. Mm-hmm. And most significantly, those patients that got the sickest were patients that did not receive the vaccine. So these were, controlled trials in each case where a group of patients got the vaccine and another group of patients got a placebo. So the early data are really encouraging and really exciting, but the virus, will mutate, and how effective long-term the vaccines will be, I think is still to be determined. Whether it's going to be like the flu, where every year we have to modify the vaccine to try to improve the efficacy, or whether it's like others, measles or hepatitis B or something else, where it's a one-time. We just don't know yet.
Great. Anyone else want to take that one on?
I would just add, again, I would preface what I'm saying, like Bill, I'm not an infectious disease expert. But the one thing I would add, Kaiser Permanente is participating in the Pfizer trial, and we are recruiting from the community. So these are community-based studies, and as such, we would assume that all of the different mutants or varieties of COVID are being tested in the subject population. So I'm hopeful that at least for these preliminary studies, that we are accounting for the different mutations.
I've got a question that just came in here. Hold on, let me call it up. This is a question on the number of currently homeless patients in your facilities? How many of them are there? And then I think just about everyone here is participating in some way on the Caritas Village project in downtown Santa Rosa, which will have, I think, something 200-300 units of permanent housing. So I guess the question is, what is your current homeless population in your particular facility? Does anybody want to take that one on?
Yeah, I can take that one on. You know, we've looked at this at various points in time, but in general, the number trends around 20% that at least have either homeless or have some housing insecurity. And so yeah, we along with everybody here at this conference has really partnered with Caritas, and also there's an effort from our St. Vincent de Paul and colleagues to provide permanent supportive housing as well. So critical element to our community, and to ensure that that we not only provide a roof over those that are homeless heads, but also provide those services to ensure the wraparound services, whether it be needs for substance abuse or other mental health disorders, so we can be there and provide those services and really get them on their road to recovery.
Thank you. Anyone want to add anything to that?
I would just add that the rate of homelessness is of deep concern, and it has been. And so whether you're patients in any of our clinics or patients in the hospital who may be living out of their cars, who may be living up on a hillside or under a freeway overhead, we're seeing those numbers increase every day. I don't have a number right off the top of my head because there's so many, as I said, in many of our clinics in addition to the hospitals. So as Tyler mentioned, really working on those upstream prevention, getting people access to care, helping them get stable and employed is extremely important part of our mission at Kaiser Permanente when we talk about housing insecurity and economic insecurity as a priority for our health strategy. In addition, we work extensively with our community clinic partners. So the Santa Rosa Community Clinic being example, the Marin Community Clinic. We have our family practice residents who rotate and treat patients there. And often when those patients need hospitalization, we do hospitalize them at our facilities as well, in addition to all our partners here on the panel. And so I think those partnerships are incredibly vital asset, also incredibly essential community service.
Mm-hmm. Well, listen, thank you everyone for being here. We've run out of time, but this has been a fantastic and very deep discussion of the topic that is very important to our community. I want to thank David, Michael, Tyler, Tarek, Dr. Carroll, and Susan for being with us this morning and devoting so much time and thought to your answers. I know you can tell that you spent time thinking about them. And I want to thank the people that made this possible to be free to our attendees here today, our co-hosts, Western Health Advantage and our Underwriter, Sutter Health, our major sponsors, Marin General Hospital, Kaiser Permanente, Meritage Medical Network, Providence St. Joseph Health, our corporate sponsor, the Northern California Behavioral Health System. And again, a thank you to the Sonoma County Medical Association that helped us get the word out about this. So I guess the message, just to summarize, if I could, again, you're prepared for whatever is coming at you. Unfortunately, right now, it's not coming at us. So people should continue to do what they're doing and be diligent about 6 feet, wear a mask, and wash your hands as often as you can. And everyone stay safe. Thank you for being with us again this morning. And thank you again. Have a nice and safe Thanksgiving. That's probably the message there. You still can have some turkey, so let's do that.
Right.
Come on. Thanks everyone for being with us this morning. Thank you.